welcome to Health Check. We are now with Dr. Michael Awua-Mensah at Claron Health International, and today, as we said, we are speaking about halitosis. Dr. Michael, you're welcome.
Thank you.
Okay, so what exactly is halitosis?
Halitosis is a noticeably unpleasant odor emanating from the breath, regardless of whether it's from the mouth or not from the mouth.
Okay.
It's from the Greek word halitus, which means breath, and osis, which means bad. That's halitosis. Other synonyms for halitosis is bad breath or a bad smell from the mouth.
Okay. Is it something that affects many people?
Yes, halitosis affects at least 1 out of 4 people in a certain time.
I pray
Yes, statistics show that one study carried out in Japan showed that about 23% of the subjects had halitosis. A similar study was carried out in '96 in US, and also had about 24% of people complaining of halitosis. And in Brazil, they had about 15% of people complaining of halitosis, with the people, the men, complain more of halitosis than the female. That's the frequency at which you have men complaining of halitosis compared to the females.
Okay.
Yes.
So can you give us a little bit of a history about halitosis?
Yes, halitosis dates as far back as 1550 before Christ, BC.
Okay.
And that's when they started documenting halitosis. The Romans used to develop certain perfume tablets they used to chew to mask halitosis. And also some also developed some leaves they used to chew to reduce halitosis. So it's been there for some time.
Okay, so you mentioned to me before about wait, let my tongue get around. Epidemiology of statistics.
Yes.
Can you give us that?
Yes, so halitosis is a very common condition. It's actually the third most common complaints that people present to the dental clinic. The first being tooth decay, the second being gum disease, and the third being bad breath. A study carried out at the University of Ghana Dental School revealed that 18% of Ghanaians had self-reported halitosis represented to the dental clinic because of halitosis. It's a pressing concern which we should all endeavor to find out what it is.
But those the halitosis sufferers, is it usual that you can smell that your breath is not fine, or somebody is telling you, or which?
With halitosis, it depends. They actually classified into 3 main groups. We've got the genuine halitosis. With that one, you know there's actually bad breath. We have the pseudo-halitosis, and we have the halitophobia. You know, whenever you use the word phobia, it's fear. So the fear of halitosis. So when we talk about genuine halitosis, it's either physiological or pathological. Physiological meaning it's normal, and pathological meaning it's because of a disease. So physiological, for instance, you wake up in the morning, you know that morning breath. You wake up, say hello to someone, but you could tell that the breath is bad. It's normal, it's physiological. And also having certain meals such as onions and garlic. Yes, you're bound to have halitosis. But with this type of halitosis, it's transient, it's temporary, it's not long, it doesn't last for too long. Yes, so with halitosis, that's one other classification. Also when it comes to the pathological, it has to do with the disease state. So you could have probably tooth decay, gum disease, something you call periodontal disease. It could also bring about bad breath. So with halitosis, it depends on the classification in which it falls. That's how you can tell whether it's normal or not normal. Okay. Yes.
So halitosis is something that seems to affect, as you're saying, 1 in 4, 1 in 5 people.
Yes.
What are the effects other than pushing people away?
So halitosis, you have the social barrier. We know you need to nail down this group meeting. You can't go because of bad breath. Prevents you from taking certain initiatives on your own because there's a fear that you may put off some people. And there's also the economic factor. Once somebody knows he or she has halitosis, you buy so many products, so many mouthwashes, so many herbal medications just to alleviate the halitosis. So it's a bit of a bother. It's a bit of a bother.
Okay. Yes. So I think that it's deeper than maybe we first initially thought.
Yes.
Yeah, okay. So what are the classifications of halitosis?
Okay, so halitosis is broken down into 3 main groups. We have genuine halitosis, we have pseudo-halitosis, and the halitophobia. And within the genuine halitosis, we have the physiological and we have the pathological. Yes, and with the genuine halitosis, as I explained earlier, that's when you wake up in the morning, you see gapoha, you can smell this very terrible breath. It's the morning breath, we call it a dragon breath.
Wow.
Yes, it's dragon breath. And we have the pathological, that's infections in the mouth. You could have certain diseases, certain cancers in the mouth that can bring about bad breath. And even plaque deposits in the mouth can bring about bad breath. And when we come to the pathological type, it could be from the mouth or outside the mouth. We group them into 2 main groups. We have the intraoral, pertaining to the mouth, and extraoral, that's outside the mouth. So with the intraoral, that's when we have the tongue coatings that could cause bad breath. We could have the periodontal disease, that's severe gum infections as part of intraoral. When it comes to extraoral, it could be pertaining to the nose. You have the chronic sinusitis, infections of the sinus. We have lung obstructions. We have pneumonia. You have all sorts of lung disease, and even tonsillitis. It's quite common.
Okay.
Can bring about bad breath.
Okay.
Yes.
I mean, because I know, I think I have a hole at the back, and sometimes if there's food that enters in, that it can cause bad breath.
Yes.
But I don't actually have bad breath. Just want to put that out there. But how do you diagnose something like halitosis other than, like, obviously there's a scent? Is there another way to diagnose it?
Yes, so depending on the classification of the halitosis, as I said, there's the genuine, there's the pseudo-halitosis, that's the people who actually think they have halitosis, but objectively there's no halitosis. And we have the halitophobia, those who've been treated previously in the past with halitosis, but they still think they have halitosis. Such groups of people actually need a psychologist to actually assess the situation once the doctor has cleared.
So somebody had halitosis before, and then they've been treated for it, and they're fine. But they still have that fear that they have it.
Yes.
But is that a major issue?
Yes, it's a major issue, because the person would look for all sorts of mouthwashes, all sorts of toothpaste to be used, and the person would even be shy to even meet up with friends and family. It's a big concern.
Wow.
Yes, and diagnosing halitosis, we have the subjective, we have the objective. There are so many subjective tests, such as coming into contact with someone. We have the organoleptic, that's done at the clinic. So you
come using big words.
You come to us at the dental clinic. The dentist is about 10 centimeters away from the client. You're able to perceive the halitosis. Yes, that's one of the objective ways of determining halitosis. Some subjective ways, we have cupping the mouth. That's very common. You cup the mouth and smell your breath. You can tell whether you have halitosis. We have the licking of the palm or the fist. Yes, you can lick it and wait for some few seconds and smell it. Yes. There are also instances of using a flossing your teeth and actually smelling the floss to see whether it smells. That's one way to determine halitosis. All these ones are subjective, but when you're talking about objective ways, that's coming to the dental clinic, we're able to use as I explained earlier, the organoleptic. That's approaching the patient. Let's say a patient talk or speak to you, you can actually perceive the bad breath. We've got the gas chromatography. It's more advanced. These equipment that we use to determine bad breath at the dental clinic. We have sulfur detecting monitors. These devices that we use to detect a certain compound in the breath. We call them the volatile sulfur compounds. And we're able to score the halitosis on such devices. Yes.
Wow. With the other thing too, I wanted to know is obviously people can sometimes get a bit offended if you were to tell them. Me personally, I'll just tell you, because I don't want you to be going around talking to people and then you've got really bad breath. That's just me. But how do you maybe approach somebody in the best manner so that the person will not be, hurt maybe
Telling somebody he or she has halitosis is very difficult. I had one friend who used to attend a Methodist church. I think it was time for them to sing their hymns. They opened the hymn book. The guy started to sing. It gets to the and at that point the person had to burst out in laughter, and that was the end. He never came to church again. That was this for the guy. It was really terrible because he asked that the guy sees a dentist. It's quite hard telling somebody that he or she has bad breath. So if you're a couple, whenever one of the partners is going to a dental clinic, or the other one accompany them, if there's a dental clinic offering coupons for certain procedures, you can even buy some as gifts and add it to a hamper to give it to a colleague just to visit the dentist. There are so many funny ways of actually going around this.
I'm going to maybe pick up some of those ways and move forward with that, because I think maybe the way that I'm going may not work for others. So be a bit more subtle about telling people you have bad breath.
Yes.
Okay, so how can one treat halitosis? Is it simply brushing of teeth?
No, with halitosis, you first need to see the dentist. Yes, mainly the dentist. We take the detailed history. We find out how the person knows about the bad breath. Is there a third party who told him that he or she has a bad breath, and the frequency or the time at which the person feels the bad breath. If it's something that you wake up in the morning, you perceive bad breath, it's normal. As I said, it's physiologic. Yes, it's just transient. But if it's something that is throughout the day, throughout the week, throughout the month, it's constant, we need to do something about it. We do a detailed examination. We examine the mouth to check for plaque deposits, to check for ulcerations, any sores in the mouth, possibly tonsillitis going on. We check for all these and we make a diagnosis that yes, he or she has halitosis, and we know how to go about it. There are even certain medications that people take, such as tranquilizers and certain amphetamines that people take, can also bring about bad breath. So there's no one common treatment option for halitosis. So depends on the patient. Until we find out the cause of the halitosis, then we approach it accordingly.
I think that we, as people, I think we need to take better care of our teeth.
Yes.
Because, like I discussed with you before, I can't remember the last time I went to the dentist. I know maybe my teeth don't look bad, but maybe there's some underlying issue or something like that. And I think people, if they were more accepting that your teeth is an important part, because I think if you have gum disease and things, that will affect everything.
Yes.
Because you can't concentrate and all the rest of it. But with halitosis, I think maybe let me use some Awua, let me use some herb, let me use this or something to try and excuse me, stop the smell from coming, but it doesn't.
Yes.
And I think, like you said, when we are able to come and see a dental professional, then it will help us and enable us to be better human beings. I think when people eat things such as onions and garlic, those scents are difficult to get rid of. How can we get rid of them? What's the best way?
Yes, there are temporary ways to mask such odors in the mouth. You can use certain mouthwashes that are able to reduce the odor. You can also use certain chewing gums to actually mask the odor for the transient period. Yes. Okay.
With the fruit gum, would that work or not really?
It could work, but it should be a chewing gum containing xylitol. That's a sugarless form of sugar.
Okay.
Yes,
okay. Yes. We learned about sugar, so we'll work on that. Okay, Doctor, thank you so much. We're really grateful for your time. That has been me, Nanama Anna Bempong, on Health Check, and we have been speaking with Dr. Michael Awua-Mensah, and we've been talking about halitosis. So we've heard about ways to be able to keep your breath in check. We'll see you again next time.